need for emerging issues. Technical briefings taking in terms of weeks, and knowledge syntheses taking a little bit longer in terms of months. So that's the kind of ministry response of different types of categories. So all members of the network could be contacted to undertake these, and we're going to be brokering that through our office. So we undertook several consultations, the first being with the HHR division, representatives from the HHR division who had some great ideas and thoughts in terms of the specific issues that they were focused on. That was really nicely pulled together and presented to us to consider which we could do. It wasn't sort of a wish list of us doing all of it, but again, in that sort of negotiated effort. Some of you attended our in-person consultation in Toronto in December, and I appreciate not everyone was going to be able to make it, but we had a good turnout, and we had some really good conversations there. So the priorities that we've identified have come out of that, not just priorities, but are sort of moving forward. And then, of course, we're having this webinar, which we're more than happy to get your feedback on any aspect of it, not just the call for proposals. So the key research priorities that have emerged from these various consultations are the following, and we haven't listed them in order of importance. We've just sort of listed them and tried to cluster them together in categories. So looking at issues of task shifting or task sharing, we could also talk about shifting and sharing and how that's enabled through overlapping scopes of practice. And again, we want to look at some particular areas, drilling it down. So we could talk about this in terms of new professional roles. Are we going to create new roles in terms of something like physician assistants, anesthesia assistants? There's some interest in. And so some of the issues that come up with new professional roles are in terms of public acceptability, working with existing professional roles, and the like. Also within this task shifting and sharing category are looking at expanded roles for existing professionals. Looking at, for example, nurses who take on more tasks in anesthesia, advanced practice nurses, prescriptive privileges for pharmacists, for psychologists, for midwives. So a variety of different expanded roles there. And trying to better understand what the barriers are, either at a micro, organizational, or a broader macro regulatory funding level to working at full scope of practice. Barriers as well as facilitators, so not just focusing on the negatives. So that's looking at different roles, shifting and sharing particular tasks. Second cluster was looking at new staffing models, including interprofessional models. Interprofessional or multidisciplinary models, so are you sharing tasks or are you just working together? And so looking again at some specific examples. What is it that works, doesn't work? So some things that came up in the different consultations is looking at anesthesia care teams. And in this case, in terms of new staffing models, because this was one of the areas that the primary care research program of OHHRRN will be focusing on, Moyer Stewart's group, we want to liaise with them to ensure that, again, we're not having sort of duplication of activities. Looking at the impact of initiatives to improve productivity, and productivity is a word that's really coming up a lot in the HHR literature. But it was, as an interesting aside, we were doing a lit review of this, and Bob Evans wrote on this topic of productivity in HHR in 1973. So what is new? What is old is new again. And to that end, the in Health Canada is pulling together a workshop on issues in regards to productivity. So there are some issues about how do we define productivity. Even the term sometimes gets people's backside up because it sounds like, oh, if you're not doing however we measure this, you're not productive. So there's a bit of negative connotation to the term, which I totally appreciate. So how do we define it? How do we measure it? What should be included in a measure of productivity? And being a qualitative researcher, I'm always sensitive to sometimes what gets counted are the things that you can count, not necessarily the things that are a little bit more esoteric and difficult to count. So that's why I put sort of little quotes around measuring how we do that. Other content areas, I should say, are looking at migration. And that's not just looking at international migration, but how do people end up migrating within a region, within the province and between provinces, and what impact do our different policies have on that kind of migration. And we can also think about the concept of broadly migration from particular sectors, right? So some people may leave one sector to go into another. So we want to, and here's just one example, labor market outcomes for internationally educated health professionals. There's been a lot of really good work done at the Nursing Health Services Research Unit on internationally educated nurses, and some new work on physicians. And our research team has looked at these issues as well. And there's a really nice linkage there with the Access Center for Internationally Educated Health Professionals. They have some really good databases, and so would like to develop some kind of relationship with OHHRRN so that people could have access to those databases and start looking at these much more rigorously. Looking at retention initiatives, and I say retention and explicitly distinguishing that from recruitment, because I think that we have often talked about recruitment and retention, and it means we don't actually focus on retention as being something quite unique from recruitment. So really wanting to focus on that. And again, a lot of good work at the Nursing Health Services Research Unit we can build on, looking at work-life balance in nursing. And again, let's look at that across other professions. There are long-standing concerns with retention in rural and remote communities, and how we can use financial and non-financial incentives to better retain health professionals in those communities. And looking at how labor market conditions affect different retention initiatives. The third point on this slide is looking at better linking training to practice, which would attend to the competency versus credentialism debate. And I've sort of presented that a bit in terms of conflict, right? I mean, it's not necessarily competency versus credentialism, but the sense of how do we know that someone is competent to do something? Is it based on the credential? And whenever we increase credentials for entry to practice for different professions, we need to appreciate that that has a huge impact on health human resources. So we wanted to examine that, and also on issues of recruitment and retention. Sometimes people increase the entry to practice requirements. That helps retain people because there's a sense of career trajectory. But so there's a variety of different things to consider in that whole issue. So it's not just planning, there's issues around retention. So we thought we would want to sort of tackle that head on. Some neglected issues, and these are just specific examples. I'm quite open to other neglected issues. So sometimes it comes up health human resource issues of managers, planners. One thing I've been asked to do in my chair role is to look at the issue of soft-funded health service researchers. So if we think of health human resource researchers and health service researchers as being important elements of health human resources, that they provide information at a system level. So health human resources should not just be focused on the regulated health professions that we tend to always see the research on. Which gets to the second point, the role of unregulated health workers, including those considered under the umbrella term, complementary and alternative medicine. So, so that's definitely an area that we want to consider. Also, people who are not necessarily recognized as health providers, people working in the community, unlicensed care assistants, other unregulated health workers that are considered to be professionals, sort of epidemiologists in public health units. They're not regulated, but they're an important component of that particular health human resource sector. And so health human resource issues in the community, in home care,